I got an elbow pain on the both side, on my foot, like ankle pain too.
Gotcha. How long has this been going on?
This one is like 2 months ago, and the right one is 2 years ago. I hit it on the both side.
So during the consultation, you told me that the medical doctor, what did he do with that left elbow?
That's a tennis elbow, and they put the injection on it, so swelling down, and they give me prescription for the medicine, ibuprofen, and I take the ibuprofen all the time, like twice a day means.
Okay. So compared to back then and to now,
you still got a pain.
No difference of pain, or some reduced pain, or what's the story with that?
No, he still got a pain, same as the problem before.
Same one?
Yeah.
Can you point to me where?
It's right over here.
Right on the spot, right over here?
Yeah.
Got it. What about the right one?
I think on this side.
Okay. Did anyone took a look at that one?
No, I just did the MRI, and MRI shows there's something tendinopathy, something like that.
Got it. All right. What about the right foot?
Right foot?
Right, tell everyone the story what happened to your right foot.
I was like doing stairs, get down on the stairs, and then I fell down on the stairs, so it's like twist like that.
Gotcha.
Yeah.
All right. Well, that's one more little misstep.
Yeah,
all right,
missed it.
All right. So what about the rest of your spine? Any discomforts or anything that you experience around here?
No, I never got a pain on my back pain. Nothing. Never.
Interesting. Well, all right. So when we go over here, the reason why we take a look at your whole entire structural spine itself is this, right? I want to make sure your structure of your spine is nice and stable. Stable spine, right?
Okay.
Versus unstable spine. Why is that key? Because if it's stable and functioning properly, there is no nerve obstruction. However, if it's unstable and shifts out of alignment, it could potentially cause nerve obstruction. It's no different from having a massive traffic jam on the GW bridge, and you have that nice, beautiful traffic jam, or another way to put it, a nice parking lot on the Crossbar Expressway that goes all over to Connecticut.
Yeah.
Okay. So I want to take a look. What's going on in this region over here and in this region over here? Why? Because in this region over here, these nerves are responsible for going to the elbows.
Okay.
Exactly. And that's what you see over here.
Yeah.
So I want to take a look. What's going on in that region? And as for your low back, even though you may not experience back pain there, I want to take a look because the nerves control the function of that ankle as well. So let's take a closer look at these two areas, see if there's any potential structural abnormalities. Now with instrumentation, we're looking for, is there any abnormalities in temperature? And we found a big one right here at this level. So even though you may not be symptomatic, already objective data is starting to show us, no, there are problems here. It's just not significant enough to register as pain. And this was more chronic, so it's a little harder to see this one. But it's right there. As you can see over here, it's chronic. I want to see this, there should be no edema at all. It should be nice and smooth like this. And yet, there's pooling of fluid in this region over here. So there's clearly an indication there's something abnormal going on here, even though the patient has no complaint of pain whatsoever. So when we take a closer look, this structure over here is moving kind of decently over here. Sacrum. It's a little stuck on the left side. The right side is moving pretty decently. Hip is moving back and forward without too much of a problem. Let's have you stand up. March, please. Go ahead. March in place. So it's a little bit stuck on the right hip over here. But you see this difference over here? My right thumb over here is supposed to go inwards towards the left SI joint. Go ahead and march again. See, it's not doing that too well. And when I do it with my left thumb, go ahead and march. See, the sacrum swivels and pivots very well on the right side. but it doesn't do so well on the left side over here. Go ahead and march again. See that fellow right there? It's stuck. So this fellow over here, that's what we're going to take a closer look at. How's that fellow over there?
It's good. No pain at all.
No pain. And yet, when I examine this fellow a little closer, this over here is not moving too well. It should be nice and smooth, fluid, like all the other structures below it.
Yeah.
This one over here, it's stuck. It's just not moving too well. In addition to, again, it should be nice and smooth over here, and yet you have fluid buildup right in this region as such. So this is clear objective data. We're going to start looking at, there's a temperature difference over here. There's pooling of fluid in this region over here. And in addition to, it's stuck over here. That clearly tells us there's something going on over here that is abnormal. So let's go ahead, let's go to the films, let's take a look. With this x-ray over here, what I want to take a look at is your sacral foundation. This triangle shape over here, you see on this, that's your foundation. Why? Because all your bones above it and everything from the waist upwards also rests on that single bone alone. So I'm concerned about is there any significant rotations? Is there any significant going forward or backwards or leaning to the sides? So when I take a look at the biomechanical measurements on this picture over here, it's not too bad. 0 to 1 millimeters, I don't care. 2 millimeters, maybe got something. Okay, we're talking 2 to 3 millimeters. And you got 2 millimeters over here, so potential. What I do see here on the sideway view, what's normal, if you see over here, this way over here. I want to see it at this angle. What I don't want to see is this vertical. What do we see over here?
The normal one?
See the angle for this fellow over here? It's kind of tilting backwards. I want to see it more towards here, not towards this way.
Okay.
So the overall sacrum, what you're doing, your little tilt backwards. Now, I'm not saying completely straight as a rod, but it is getting there, just a bit. Now, in terms of the tilting to the sides, you are listing a little bit towards the left. So now we got this combination, slightly rotated towards the left, sinking downwards on the left side, and leaning backwards. So as in other words, since you're in this position, is it possible you can walk like this way?
No.
Right? It's kind of hard to walk this way. So, because our head has to be here, straight and level for you. So what your body did was, it twisted a little bit to compensate, to keep that head level and straight for you. And that's what we see over here. So these structures in the lumbar spine, I want to see it straight on and level. And yet yours is rotated, following along what your foundation did. That's what it did over here. And then it gradually compensated to go over this way. Now, when I checked on you, your second dorsal over here, it did not compensate correctly. It went significantly towards this way and this way in relation to all the other structures. In other words, it deviated even more than it's supposed to be doing. And that fellow over there, that's what we confirmed on you. That's not a hand camera. Exactly.
On the right side, right?
So, right over here.
Okay.
So this particular structure over here, that controls the nerve function from both all the way down to the elbows. So we need to correct that second dorsal vertebrae and that foundation of yours, in addition to the elbows and your foot. That's a little more. Come on up. Walk around a bit. Go ahead, walk around. Any difference you notice? I'll tell you what.
I feel like a little bit good,
Good in what way?
but the elbow,
Oh, the elbows feel already better?
yeah, it's good, a little bit better.
Which one? The right or the left?
Both of them.
Both of them.
Yeah.
Interesting, isn't it?
Yeah.
Do you understand why that foundation correcting the bottom helped your elbows?
No.
You want to know why?
Yeah.
So, just like a foundation for a house, or even the Leaning Tower of Pisa, if you have a stable foundation, all the structures above it will be stable as well. So, as we explained earlier, because your foundation was knocked out of alignment, all the structures above it had to twist to compensate. So because it twisted compensated and it put a lot of pressure right over here, that's why you lost some nerve function going down to your elbows. When we untwisted this and corrected your foundation, it alleviated the biomechanical pressure off of here. So it's not as twisted as much over here, therefore alleviating the nerve obstruction, resulting in more nerve function to both your elbows, and that's why you feel a little bit better. By what percentage would you say that both of your elbows are better?
I would say 40% better.
40% better. Good. Walk around.
A little bit pain here.
Okay.
After you did that.
That's it. You gotta walk around a bit. How's the elbows now?
Elbows is good. Elbows feel better now.
Better after we did that correction?
Yeah.
So you mentioned before it's 40% better.
Yeah.
How is it now?
Now I would say like 75% better.
Okay, that's good. Point to me, where do you feel the problem? Right in that region. Got it. So when we take a look at the extremities, the general rule of thumb with the Gonstead work, we always clear the spine first to restore proper nerve function to the extremities themselves. So up to this point, as you witness and seen yourself, the patient now expresses 75% improvement into the elbows already. So let's go ahead, let's take a closer look what's going on these elbows here. So you experience some discomfort right here?
Yeah.
Okay. What about here?
A little bit pain.
A little bit, right? What about here?
No pain.
What about here?
Yeah. If you press then.
What about here?
No.
But you feel more here.
Yeah.
So what we evaluate right now is, I understand, even though you may feel pain over here, what I examined already is your radial head. This is what's misaligned. The ulnar itself is not. Nothing on the medial side, and there's no edema present there. On the lateral side, very minute amount of edema present. But when I come to the radial head itself, there's a lot of edema going on right over here. And this just feels like it's chronic. Or more correctly, more like subacute. Right in this position over here. And when we check on the other end, see on this distal radius, this is fixated. It's not moving. See on your right wrist, you feel this difference over here? This is moving. On your left, feel that difference there? It's stuck. Now we reevaluate what's going on over here. How is this now?
Still a little bit pain, but
Got it. There it is. It's a tiny little piece. Okay. Move it around.
yeah, I don't feel like any pain right now.
Oh, how do you like that?
It's good.
A little more. There it is. Okay, walk a bit. Okay.
Good.
Close in. How is that?
It's awesome now.
Good. See that difference already? I can't fully push this foot over upwards. So you can easily do it with your left. Can't do it too well on your right. That tells us there's something going on with this talus we're going to take a closer look at. your talus on your left foot, I can pivot medially and laterally, meaning the inside and the outside without a problem. On your right foot, this talus over here, doing the outside, stuck on the inside. So we have a medial misalignment over here. Check all the rest of the structures in your foot. Okay. So now you just have a talus problem. So we're going to pump this up before we set it. Let it go. Let it go. Right there. There it is. See, it's symmetrical now. I can raise it both of them upwards without too many problems. The tibia over here is not moving too well. I have to set this a bit. How's it now?
Much better.
That's all it took.
Yep.
I understand, you didn't experience any pain in your spine assault, but there's a reason why we had to correct the structure in your spine first. Because I could correct your elbows and your ankle all day long until the cows come home, but it won't stay put. Why? Not enough nerve function come from your spine into the elbows and the ankle. If we don't have enough nerve function, how do you expect the ligaments to hold those bones in your elbow? Right? So I could, like I said, keep on correcting them. It will not hold because it does not have enough nerve function to hold them together. That's the reason why we have to correct the structure of your spine first.
Oh, okay.
Right?
Yeah.
Okay.
Yeah.
We're all set, champ.
All set. Thank you, sir.
You're welcome.
Yep.